Navigating Special Education Laws, Policies and Protocols with Advocates, next on Carpe Diem. In an environment where expenses are rising and budgets are being slashed, one area of the school budget that cannot be cut is special education. It is a required offering that grows more expensive by the year, outpacing state and federal aid. One of the most prolific causes for this increase is autism. The rate of autism in New Jersey has doubled in 6 years to 1 in 49 children and 1 in 29 boys. 2% of children in the state are now identified with autism by their 8th birthday. According to the New Jersey School Boards Association, on average, school districts spend about twice the amount to educate a special needs child as they do for a student in the general populations. Hello, I'm Stephanie Petchers and welcome to Carpe Diem. For parents of special needs children, navigating state and federal laws, special ed theory and practice and protocols of public education access can be daunting. That's where special education advocates come in. My guest today is Dr. Gerard Costa, the director of the Center for Autism and Early Childhood Mental Health, a division of the College of Education and Human Services at Montclair State University, and Heather Amoroso, mother of a special education child. How are you?
Good, thanks.
Thank you for
Hi,
being
Stephanie.
with me today.
You're welcome. Thank you.
Dr. Costa, let's start with you. Let's start off with what is autism?
Autism is a neurodevelopmental disorder that affects the structure and functioning of the brain. Both areas under the top layer of the brain, the subcortex, as well as the cortex. So it really affects the way children experience the world, their sensory systems, the way in which they even experience their own bodies, and certainly the way they experience relationships and their ability to communicate. And so it's, as you know, it's been identified more frequently in the recent history, and so I think we all are concerned about how best to help children and families affected by autism.
Absolutely. Now, what and whom can be classified, as autistic?
Typically, autism is defined as children having difficulties in 3 primary domains. In social relatedness, it may mean an absence of social relationships or really an indiscriminate quality, that children may in fact have a connection, but it seems indiscriminate. But some difficulty in social relationships. That might include eye contact, it may include reciprocity, and communication, two-way back and forth communication as we're doing now.
Yes.
It also can involve some impairment in the use of cognition and play. So they may have stereotypic behavior. They may show themselves in play by becoming preoccupied with certain parts of objects or certain actions. And they also have an impairment in communication typically. That could be some difficulty in affect and gestural communication, reading facial cues, reading social situations. And it might in fact involve some impairment in speech, although many children on the spectrum have adequate speech, but they might not always have a communicative aspect of speech, or what we call a pragmatic speech. So it's really those 3 areas impaired with difficulty in social relationships, communication, and in some way, some stereotypic behaviors.
Okay, and now when it comes to school,
Yes.
how, if they have like a low strain of autism and it's not, not as high of a strain, are they still considered special education, still put in those classes, or it kind of depends on the kid?
It depends on the child. The distinction too, there's a diagnosis that's often given of autism spectrum disorder, and that's typically when criteria are met in a certain manual uniformly used among many providers, known as the Diagnostic and Statistical Manual, now coming out with a 5th edition, which is redefining autism as autism spectrum disorder. But schools are based on a special ed classification code, and so that special education classification code must be complied with in order for a child in school to be given the classification of autism.
Okay.
They're very similar but not identical.
Okay, gotcha.
Yeah.
Now, Heather, your son has autism. How?
Well, he's not autistic.
Not autistic?
Yes, but he's just got speech. He's in special ed.
Okay.
He's delayed from being born early. So.
Oh, from being born early.
Yeah.
So did you know that there was going to be an issue from him being born early before he was born?
Not really. Honestly, I took my son to early intervention just because he's a twin, and my daughter started walking about 12 months, and 12 months went by, 14 months, 16 months. He wasn't walking. He didn't really start walking until I put him into early intervention, and about 18 months he started walking. But he started getting therapy for it. During the process of evaluating him for the physical therapy, they came across that he had these delays in speech and occupational work. So he's been in speech therapy and occupational therapy since he's been about 18 months old.
Wow, wow. Now, what kind of services are typically available for special needs? What kind of services did you have available to you for him?
In my town, I live in Woodbridge.
Okay.
At 3 years old, he was accepted into the special education program. It's called a preschool disabled program, which I don't know if I like that or not.
Yeah.
But he actually, at 3 years old, day after his 3rd birthday, they put him into preschool. And at preschool, he goes for half a day, 5 days a week. He gets physical therapy, speech therapy, occupational therapy. He gets to be in an environment with kids maybe at his own level.
Yes.
And he's enjoying it. He definitely learned so much just from being around his other peers. But it's definitely something that you have to fight for sometimes.
Yeah,
Yes.
absolutely.
Yes.
It's not easy. And how do you deal with a situation where, I don't know if this has ever happened to you, but for one reason or another, the school doesn't want to give, services that parents feel are necessary for their child?
I've been lucky that they've actually given my services to my son since I've put him in there. But other parents I've talked to, they definitely have had to fight with them. It's all about money sometimes too.
Yeah.
I know that schools want to do the best for the children, but when there's budget cuts, they're cutting out everything else. They want to look where every penny's going. Just for an example, my son actually was just released from the special ed program, but now, right now it's mid-April. Instead of releasing him now, we take him to the end of the year, they're releasing him now.
Yeah.
For like 6 more weeks, they don't want to pay because they
Really?
figure he's not special ed. We're going to cut the funding right now, and he's going to.
And they could just release them
And they're
like that.
releasing him now. So it's a little, hard to explain to him why. Well, all his friends are still going to keep going to school, and he's not. But it is what it is.
Yeah, wow. Now, Dr. Costa, what are some of the reasons for an increase in autism, and why do you think New Jersey's percentage is so high?
It's very hard to know. I think the field is struggling with that question. We do know that autism is not caused by faulty parenting. We know it's somehow a neurodevelopmental disorder. Much research is looking into some theories behind what might be going on. There are lots of research projects, too, in New Jersey that are very active at Rutgers University and UMDNJ, looking at the genetics of autism, some aspect of the genetic and chromosomal markers that might suggest a child might be at risk for developing this disorder. And there are other theories that talk about autism perhaps being a kind of autoimmune disease, that our own immune system somehow for those children is becoming self-injurious. So I think the theories are really not clear. In 2012, when the data first came out about autism in New Jersey being 1 in 49, at the time nationally 1 in 88, there was a theory that somehow families moved to New Jersey for better services, because New Jersey has been concerned about autism for some time. But it turned out that in the 2012 report, over 80% of the children who were identified as autistic were born in New Jersey. So the migration theory is not there. So we really don't know the question. We certainly know partly it's because more awareness.
Yes,
Families are much more willing to talk about autism. We know some of it is better assessment and earlier assessment. We in the field have identified characteristics of developmental difficulties much earlier than the traditional age of 3. At one point in our field, it was rare to identify a child with autism prior to age 3. We now can actually see some early indicators as young as 12 months of age to 18 months of age. So some of it is that, but I think some of it is an authentic increase for reasons we just don't fully understand.
Just don't know. It just happens.
It happens, and I think, of course, for families and for young parents who are, or families that are beginning, it's a frightening thing. And I think in some ways the frightening aspect of autism is a misconception about autism. I think there are many misunderstandings about what autism is. If I could say, for example, children with autism can have a full range of optimal intelligence, but they often are beset with a neurosensory system that reacts to typical environmental stimuli as if they were overwhelming. So the lighting in this studio, the sound doesn't really bother me, but I think there are some children who might be very bothered by the lighting or by the spatial arrangements of objects. So their neurosensory system is often responding in a way that appears as if they're overwhelmed by normal circumstances. I also think there had been for years this misunderstanding that autism was a disorder of attachment. It turns out that research is showing us that almost a similar ratio of children with autism to neurotypical children have secure attachments with their parents. They may not manifest the attachment in the same way. They may not make as much eye contact with their parent or turn around when they walk a distance from them, but they absolutely are connected and attached to their parents. And they absolutely have much greater abilities to communicate. We really need to help them develop alternative ways to help them communicate with us.
Now, to go off that, when you found out, how did you go about it? Were you nervous? And do you see differences? I mean, I'm sure you see differences, but are the differences like extremely drastic between, the way your son behaves and the way your daughter behaves?
Certain things, like my son's you're saying about the intelligence, he's very smart. Like, I'm amazed because he reads. Like, I don't remember reading at 4 years old, but he reads like nothing. But he definitely, especially in situations, like you were saying about the sensory issues, like I noticed, I'll make a bath for her, she takes a bath, whatever. Him, it's hot, and you're touching. It's like, it's not really that hot, but he feels it that way, and it bothers him. And then just the way he deals with emotions sometimes. He's very regimented on what he wants to do. He wants to get up. His daddy takes a shower, so he has to go eat breakfast with daddy's taking a shower. And if something is amiss, if something gets thrown off of that schedule, he loses it. He'll start, he'll go back saying, no, go take a shower. He wants everything to go in the same order every single day, which, sometimes it doesn't, and then we have a problem.
Life is less predictable.
Exactly. And while I have my daughter, it just kind of goes with the flow. Like, we change. We see what we got to do.
Yep. Now, we see how services such as speech, physical, and occupational therapies can help a young child catch up to the abilities of their peers. What kinds of other services are offered to older students and beyond that, people that aren't aware? What services?
Yeah. I'll begin that discussion a bit. I do think, by the way, that it's so critical to think about those occupational therapy, and some children really require help with physical therapy. I also think the mental health services, many times children with autism and other developmental difficulties, in part because their neurosensory system is more sensitive, can sometimes have as a byproduct of that anxiety. So many times children become anxious when the world doesn't feel as comfortable to them. And so we have to think about even some early childhood mental health interventions that typically schools are not that well trained in or educated about. I think those are needed. But there's a concept in education that's so critical called differentiated instruction, where we really have to be better able to identify what works for this particular child. The core curriculum standards are there for all children. And many times children with autism cannot learn in the same way that a neurotypical child might. So educators really need lots of help in figuring out how to modify instructional strategies that really help this particular child learn. And I also think, Stephanie, and I think it's important to think about this both in terms of the early intervention programs, they're called Part C, and the preschool disabled programs called Part B. We really need to think much more carefully about inclusive settings. Inclusion is not a place, it's an idea that children should be integrated in every step of the way. And in many respects, children with autism and children with other developmental difficulties are part of a normal range, a wide range of children. And each child needs this more individualized, differentiated instruction approach. So those are the directions I think we need to go. Within our state, I think that inclusion as a practice is woefully inadequate. I think New Jersey is not terribly good at full inclusion. Many parents need advocating for inclusion. And so I think, you know, that's hopefully now that he's no longer classified, he'll have a chance to be fully included. But all children with classification really need to be thought of as just being part of the educational system.
Yes, yes. Now, how do you, your son's experience throughout school, how do you feel, you know, his educators handled it? Were his teachers good?
I think that his educators have been wonderful, honestly. I think his teachers have been wonderful.
Good.
I think his therapists have been wonderful. Most of the problem that I've had, you know, with my son has been in the administrative, let's just say, end of it. You know, like again, they have different functions, I'm guessing. I assume they are thinking more about the budget than my son, but then but then they make other decisions I think are odd, such as we have in my district, we have 3 schools that have the special education program, and instead of sending him to the school, which is 3 blocks away from me that we could drive to or walk to, they would rather put him on a bus and put him on a bus for an hour in the morning, an hour coming home, and pay for that and pay for an aide to sit with him because he's still only 4 years old, as opposed to just sending him to the closest school. But you know, but then in other things they'll say, oh well, we don't have the budget for that, or the other. You know, I know parents that have to get lawyers that involved, along with the advocates. Sometimes even they have to get lawyers involved to get what they believe their kids need for their school, for their education.
Yeah, I can't believe that they send him an hour when you have a school 3 blocks away.
But that one's full, and that's just how they do it because they have their way of doing things, and they can't kind of look outside the box sometimes.
And I don't know if it's the case in this instance, but that often happens when a school site is designated for special education students. So there might be a nearest school, but if there's no adequate special education services there, they'll take a child or bus a child elsewhere. And yet if there's full inclusion, every school should have that opportunity. Every family should have a chance to go to their community school, go with neighbors and have friends. So I think it's partly related to that issue of inclusion.
Now, Dr. Costa, some may ask if it's better to enroll special needs children in private schools.
Right.
What are some of the advantages of mainstreaming versus private schools, and what is ultimately better for the child?
Sure. Well, you know, there's always going to be a need, I think, for some private schools in separate, segregated settings, although I think it's exceedingly rare that we need them. I think our vision of child education should really be that all schools can help all children and teach them together. That's a vision we have of society, that this diverse society can work together. So I think, for the most part, private schools, for the most part, are self-contained settings, and I think in general that idea is contrary to full inclusion because they are segregated in special education settings. There clearly are some children who benefit so greatly from having that focused, well-trained peer group, a population of educators with a peer group who can really work together. I would love to see, though, we become more of an inclusive setting so that public education systems are well trained and well supported. Now, there are some examples. Montclair State University has a wonderful center, the Ben Samuels Children's Center, which is a wonderful model of birth to 5, especially 3 to 5, full inclusion program. So if you walk through that center, it's holistic and multidisciplinary. They have occupational therapists, speech and language pathologists, educators, school psychologists, physical therapists, music therapists, storytellers who work with children in wonderful early childhood ways. And you cannot distinguish which child has an IEP, individualized education plan, and which child is a child care child. So I think that's the goal. So there is always going to be a need for private schools. But I think all of us would like a strong public education system that's more fully inclusive, and that requires a new kind of professional development that I think, by the way, Montclair has taken leadership in. Montclair University is a leader in dually certifying teachers. So they're both certified in education and special education, so they know the range of children who will come to their classrooms.
Now, have you ever heard, I don't know, has anyone ever went to homeschooling
Yes,
rather
yeah.
than sending their child to school? Do you think that's better, that, or do you think that it's better to send, a child with special needs, into a school atmosphere and, around people, or is
That's a great
homeschooling-
question, because I know families have make those decisions based on such strong principles about their responsibility as parents. I just saw a television program yesterday about a family that is homeschooling all of their children, and 3 of their children under 17 are in graduate school, or some are in college, some are in graduate school. So there certainly can be home education that really is wonderful and promotes intellectual development. I think holistically it would be wonderful if parents felt their local school was responsive to their needs. I often think parents make the decision to homeschool because they're not sure this local educational opportunity is appropriate for their child, and so they make these very hard decisions, lifestyle decisions. Often for homeschooling, one parent is not working, except working full-time to educate their children. But I think if I had my preferences for the kind of educational system we have, I would love to believe that our educational system can be so responsive that fewer parents would feel the need to homeschool.
Yeah, I guess it's a hard call.
It's
It
a very
probably
hard
just
call.
depends, on the family.
Biggest
and-
responsibility is to be a parent, sure.
Yeah, that's hard.
Absolutely, yeah.
Now, how important is early intervention in the future of the autistic or other special need child?
It's huge.
It's
I think
huge.
Amen.
It's huge, yeah. Because, I mean, like I said, with this early intervention, I didn't even know anything was wrong. Like, I thought he didn't walk. That was
Yeah,
the only
that's
thing.
it.
And then he said, well, he should be speaking this many words. And then when I sit and I think about it, and I said, okay, compare and contrast with my daughter, who, I was like, oh, yeah, he does not talk as much. But it's not something that, I don't know, doesn't stick out, because everybody sees their child and they think they're perfect
Yeah, it
and
doesn't
wonderful,
click,
and,
yeah.
Sure.
nothing's wrong with them. So, that's, and then it's amazing, because now he never shuts up. He likes
to talk.
Talk. But this is a kid that, didn't like to talk at all. So I think it's wonderful for children.
Neurologically, it's absolutely essential. What
Yes.
we have learned about brain development in the last 15, 20 years is overwhelmingly clear about the importance of earliest experiences. So at 5 months gestation, just to give you some idea of our brain systems, 80 to 100 billion neurons, nerve cells, are in our brain. At birth, about 20% of those neurons have these kind of interconnections. 80% of the connections that form both across our hemispheres and from lower centers to higher centers to have a fully balanced and integrated brain, 80% of those connections occur post-birth. So the brain is experience dependent. It's waiting for those early experiences to begin to hardwire. There's evidence that children with autism have certain brain regions that are overly responsive or under-responsive to certain experiences. So early experiences will tailor those, help remediate those. Every nerve cell of those 80 to 100 billion neurons can make up to 10,000 connections a day. And so those connections are 10,000 connections a minute, I'm sorry. So these are remarkable, remarkable opportunities that if we don't invest in early intervention now, and we're doing more, but not enough, especially birth to 3, by the way, especially birth to 3.
Yeah, because it's
And
usually afterwards, right, that they're
that's right.
detecting it.
And
but
that's
you
why
want-
our center was created, the Center for Autism and Early Childhood Mental Health. It was created because we have to promote professional development, clinical services, educational professional development around the importance of the earliest relationships and early experiences, especially emotional experiences. When babies are born, the right side of their brain and the lower brain centers are very active. The left side of the brain, which we think of in terms of language and intellect, is not as online. So affect and early relationships are critical, especially for children who have these early special needs.
Absolutely. Now, autism can be a very difficult diagnosis for a parent, as we said, especially because it's been so prevalent in the media as of late. What kind of future outlook can you give to these parents? And with the proper services and therapies, can parents have an optimistic hope for their child's future?
I think the answer to the second part is absolutely. There's an increasingly important perspective that's occurring in our field called neurodiversity. This idea of neurodiversity is that each of us has a unique neurobiology, that each of us has unique sensitivities that we all make adaptations to. And within the normal range, some children can't stand that little tag on their T-shirt. Or my own daughter, who's 25 now, as a child, I would have to fold over her socks because the seam on the socks bothered her, and I would keep folding them over until she could get her shoe and her foot in the shoe. So there's a normal range of that. But there are some children who have more difficult and more interfering kinds of sensitivities. And so when we identify those earlier and help children develop some capacities for self-regulation and neurosensory regulation, I think there's an absolutely optimistic trajectory. It's not to say that our goal is to cure autism. I think our goal is not to cure autism. Our goal, really, autism awareness is the month of April, is autism awareness. I think it should be autism acceptance. I think we all have to understand that children with autism have capability of warm, related connections, attachments, and intellectual development. We just need to think about how we be more aware and help them adapt, not to change them to fit the world, but help the world.
Autism awareness. Thank you so much for being here. We're out of time. If you would like more information about this or any other edition of Carpe Diem, you can write to us at carpediem@mail.montclair.edu or call us at 973-655-5158. For Carpe Diem, I'm Stephanie Petchers. Thanks for watching.